Welcome everybody, and I'm Tiejun Tang. First of all, I would like to talking about why we need to learn TCM. Yeah. So we have NHS in this country. Why we need to learn the alternative medicine, TCM? So NHS, you can see the doctor is free of charge. But why we need TCM? So that is because the modern medicine have too many problems, have too many difficulties to have to face. So like, for example, the metabolic syndrome. What is metabolic syndrome? I will talking later in my lecture, 5 minutes, 10 minutes lecture. So that is hypertension, high blood sugar, and hyperlipidemia, and overweight, obesity. So if 4 of these happens in the same person at the same time, that is a metabolic syndrome. How to treat in this condition? So in the Western medicine, they need many tablets, chemical tablets. They need hypertension to reduce the blood pressure. Maybe is beta block, maybe calcium block, maybe ACEI, whatever. And also the patient need statin, which can reduce the cholesterol. And also maybe they need something for reduce the blood sugar, like a metformin for diabetic. And also maybe doctor will give some aspirin as for the blood thinner. So many tablets, and maybe give some vitamin E, or some people, because taking so many medicines, the stomach discomfort. So some people have acid reflux. The doctor maybe prescribe some omeprazole. So add more and more tablets. So these tablets, each tablet has side effect. These side effects accumulate together, making a lot of trouble. You can't stop anyone. If you stop the blood pattern, blood lipid, cholesterol will rise up. If you stop hypertension, the blood pressure will rise up. So you can't stop anyone. And secondly, drug resistance is a big problem. Like antibiotic get resistance. That is one of the biggest threat to the global health and food security and the development today. This is come from the website of WHO. So drug resistance is a big problem. In this condition, when the patient getting the treatment by antibiotic, first time it works well, the second time it less working. If third time doesn't work at all. So in this condition, that means the antibiotic get resistance. We need some nature antibiotic. So in this condition. And the third one, some Western medicine, they like chemotherapy in the cancer treatment and the radiotherapy. They can't recognize which is the cancer cell, which is the normal cell. They kill everything, causing a lot of side effects. The patient after chemo or radiotherapy, their red blood cell or white blood cell has significantly reduced. The doctor have to stop the chemo. If they continue the chemo, the patient may be died of incurable infection. But if they stop chemo, the patient may die of the cancer. So it's very difficult in the cancer treatment for some cancer. So Western medicine is a single target. Western, but Chinese medicine is a multiple target. It can treating the patient, treating the disease in several different ways. not only in one way. So that is the advantage of the Chinese medicine. Like Western medicine, like antibiotic A, they only treating bacteria A, target the bacteria A. Antibiotic B only target bacteria B. And antifungals only target to the fungal. And virus only target to the virus. But in Chinese medicine, a decoction have several different, maybe 10 or 20 ingredients. Each ingredient has several sub-ingredients. They boil them together, make it into a decoction. It can treat in many different kinds of virus, bacteria, and fungal, whatever. So that is treating more wide condition. And that is the advantage of TCM. Why we need to learn the TCM in LACA? I think TCM is a whole big conception. It including Chinese herbal medicine and acupuncture, and moxibustion, and cupping, and the Tui Na massage, and Qigong. So several different, all included in the TCM. And inside acupuncture, we have scalp acupuncture, electric acupuncture, ear acupuncture, and different kind of acupuncture. You can learn everything, every acupuncture, and herbal medicine, and massage, and moxibustion, and cupping, all you can learn in LACA. So why we need to learn so many things? Because if you only have acupuncture, that means you're only working with one leg. If you have acupuncture and herbal medicine, you are working with two legs. And if you have a moxibustion, you have a Tui Na massage, you can run it fast. So that is why we need to learn Chinese medicine and acupuncture, Chinese herbal medicine, cupping, Tui Na. We use all the technique together. It's better than single use. There's research, unfortunately, I can't share this screen. This research showed that they use the research, they treating the arthritis index. They found they have three different groups. One group is treated by acupuncture only. The second group is treating with the Chinese herbs phenomenon. It's obstruct from the qingfeng teng, obstruction substance from the qingfeng teng. And the third group is compare qingfeng teng and acupuncture together. So after the treatment, it shows the herbs plus acupuncture is significant. The arthritic index is significant lower than other two groups. So this is published in the about 2 years ago, yeah, in the English magazine. You can read this. It's a very interesting research. So this research tells us a combination of herbs and acupuncture will have better effect than single-use herbs or acupuncture. So acupuncture, let's go back to nature. Acupuncture, Chinese medicine, is why we need to learn TCM, because it's safer, it's cheaper, it's more nature and more convenient. Because no side effects, of course, it's safer. and cheaper. Maybe some people said in NHS, we don't need to spend any money, even more cheaper. But actually, sometimes some medicine is not covered by the NHS. And in some condition, if you go to the private hospital or GP, it's much expensive. And NHS, you can't get the, sometimes if you want to have a scan or and some appointment, you need long waiting list. Sometimes just because the diagnosis has been delayed and too late sometimes. So, and the TCM is more convenient and more nature. It's no chemical substance, no environment pollution. It's better for environment protection. So that is why I recommend TCM. Let's go back to green. Let's protect the environment for our health. And as for the herbal medicine program in the LACA, we have, generally speaking, we have 3 modules. First module is TCM basic theory and the diagnosis. In the first year, that's module 1. And second year is module 2. We introduce individual herbs and formulas. You will learn hundreds of individual herbs, maybe 300, over 300. And you will learn also 200 or 300 formulas, commonly used formulas. And at third year is module 3. We will introduce the management of the disease and conditions, how to treat in the internal disease, gynecologic disease, terminal disease, and pediatric disease. So in the different clinical conditions, how to use the herbal medicine to treat in this disease. So that is the third year. We have the module 3. But if for the new beginner, if you never learn Chinese medicine and if you don't have any knowledge, we need to start from the module 1, spend 3 years. If for acupuncturist or if somebody already have some Chinese medicine basic knowledge, or already is an acupuncturist and practice acupuncture for many years, you can start from the second year. You can directly to learn herbs, formula, and clinical treatment. So that means only need 2 years. So from the beginner, maybe need 3 years. From the already acupuncture practitioner, or some other like massage therapist. So or somebody, if you already have some TCM knowledge, you don't need to learn from the start. You can start from the herbs and formula directly. So that is about Chinese herbal medicine program of the LACA.